Welcome back to Lesson 3 of Section 9 of Hope. I hope the last lesson helped you to clearly understand what core beliefs are and how you can begin to identify them in your life. In this lesson, we will explore how beliefs work and more specifically, how they affect us. The truth that is important to understand about how our beliefs affect us is first because we most often live and feel what we truly believe. Cognitive behavioral therapy is an evidence-based mental health treatment shown to be effective in helping reduce depression, anxiety, anger, guilt, and other mood-related problems, and is widely used in clinical practice, and can help explain how core beliefs affect us day to day. One of its simpler forms is illustrated in the ABC model, which stands for Activating Event, Belief, and Behavioral Consequence. An activating event is an event, whether internal or external, that came before the emotion or reaction we have to a situation. The belief is our internal assumption and worldview of feeling concepts, such as we've already described. The behavioral consequence is our reaction, whether internal or external, in our response, communication, or actions based on what we believe. Like the idea of tracing back the fruit of our tree that we've discussed previously, the ABC model can help us understand our reactions and internal connections that will increase our insight and ability to make different choices about what to do or how to begin to change. However, this model can also be expanded to show the additional internal factors at play when considering the role of our beliefs in the process. Here's the sequence of events that typically occur rapidly inside of us as we live our lives day to day. 1. An activating event occurs, whether inside of us or outside of us. Automatic internal beliefs and self-talk kick in. Attitudes and emotions are triggered. We respond or act behavior towards self or others. And then consequences or results in our lives or relationships occur. As you can see, our core beliefs drive our responses and behaviors in almost automatic fashion. So indeed, what we believe matters and is rooted in either grace and truth or law and lies. According to the Bible, grace and truth leads to life, whereas laws and lies lead to death. As you identify and consider your self-talk, mottos, philosophies, and the core beliefs you hold, step back and ask yourself as you identify each one, how would I feel if I believed this? Using our previous example, I might ask myself, how would you feel if you believed the driver of the car that you cut off was a morally bankrupt jerk? The answer is clear that it would be hard not to feel angry and justified in my reaction if this is what I really believed. This process can help you begin to see the connections and better understand why you feel the way you feel and react the way you do. The second way that our core beliefs most commonly affect us is through toxic shame. Not all shame is toxic, however, and some shame is normal or needed in some situations. But the role of toxic shame as an underlying framework of belief is vital to understand because it can operate like a filter that taints all of our beliefs and keeps us from receiving the grace and truth we need to be free. Toxic shame is rooted in feelings and beliefs such as the following: I'm not worth it or worthy. I'm not good enough or I'll never be good enough. I don't deserve it. I am bad. I have to earn love because I'm not worthy of it. I am less than others. I am inferior. Things are automatically my fault. Overall, toxic shame is a feeling that something is inherently and permanently wrong with us that is not wrong with others. Shame leads us to chronic feelings of inadequacy, inferiority, unworthiness, and feeling like we are just never good enough. Before you continue the lesson, pause the video to place a check mark next to the feelings you can regularly identify with from the list on your note-taking guide. Here's how we learn toxic shame. We learn toxic shame from experiences of rejection, loss, isolation, abandonment, or ongoing, unresolved, or poorly managed problems, consistently unfair, unrealistic, or unreasonable expectations in our relationships, especially in our family of origin, where there is an inability to function with a consistent balance of grace and truth and attach to others in meaningful, authentic, and appropriate ways. Regardless of the resulting emotion, behavior, compulsion, or addiction, toxic shame can be portrayed as a cycle that continually leads us to the same feelings and results. First, we have feelings of toxic shame or unresolved guilt based on our sense of disconnection in past events, experiences of rejection, humiliation, or trauma like we just described. Then, we internally fear exposure and fear rejection and loss, so we keep our feelings, struggles, and thoughts a secret and suppress or suffer them internally. In essence, we act in on ourselves. Then, secrecy, fear, and suppression lead us to feeling further alone and/or more isolating ourselves to avoid more shame. As a result, we separate ourselves from God and others emotionally or physically to avoid more pain and rejection. Then, events, circumstances, or stress eventually trigger us and we anticipate the shame, feel overwhelmed or unable to manage the internal pressure, loneliness, or struggle that we have. And we act out in some way emotionally, behaviorally, compulsively, or relationally to relieve the pressure, find temporary relief or comfort, or boost our sense of worth or value, or to medicate the pain temporarily. But then we feel ashamed and guilty for how we acted or responded again, internally or externally, because the solution didn't work, and we return to step one. Here is a picture of what the shame cycle often looks like. Powerful toxic shame shows up in our thoughts, emotions, behaviors, relationships, sexuality, and desires as we seek to avoid its pain and keep us trapped in the destructive cycle of trying to medicate it or perform our way out of it until we break free. If you can relate to this shame cycle, it is important that you also identify some of the acting out or acting in behaviors that for you personally are part of your solutions to managing shame. Your solutions would show up on this cycle in the acting out category. Some common struggles people have in response to toxic shame as their solutions include substance use or abuse, whether illegal, legal, or prescribed drugs, binge eating, pornography or compulsive sexual behavior or masturbation, relationship addiction or acting out including promiscuity, serial partners or marriages, multiple partners, affairs, or more, fantasies that being someone or something else or changing your body or appearance will solve your pain, internet or gaming addiction, exercise addiction, perfectionism and relentless pursuits of success or perfect performance, rescuing and taking care of others or animals as a source of self-worth, suicidal thoughts, cutting or seeking other sources of pain as a means of mental escape from painful emotions, intrusive thoughts and compulsive internal needs to fix or solve problems and anticipate the needs of others to avoid rejection or feelings of inadequacy. If you find you rely on these or other internal or external activities to manage painful emotions or feelings of not being good enough, you are likely struggling with toxic shame as a factor in your core beliefs. And because changing our core beliefs, especially those driven by toxic shame, is so vital to healing, it is important to know what you can do to begin to change them. You will learn specific ways to do this in the next lesson. In Lesson 4, we will begin to explore strategies for changing core beliefs. I'll see you in the next lesson.